If you watched my previous video on the powerful benefits of combining oregano oil and black seed oil, you absolutely need to watch this video before you start taking them together. Because there are 7 serious dangers that most natural health websites and supplement companies don't warn you about. Some of these risks could be life-threatening if you're not aware of them. I'm going to walk you through each danger carefully, explain who's most at risk, and show you how to use these oils safely if they're appropriate for your situation. Let me be clear from the start, oregano oil and black seed oil can both be beneficial when used correctly, but they're powerful compounds that affect your body in significant ways. When combined together, those effects can be amplified. According to research published in Evidence-Based Complementary and Alternative Medicine, essential oils and herbal supplements are not automatically safe just because they're natural. Some of the most toxic substances known to medicine come from plants. So let's go through each danger systematically, starting with the most serious ones that could send you to the emergency room. Danger number 1, severe blood-thinning effects. Both oregano oil and black seed oil have documented anticoagulant properties, meaning they thin your blood and reduce clotting ability. According to research in phytotherapy research, oregano oil contains carvacrol and thymol that inhibit platelet aggregation. Black seed oil, according to the Journal of Ethnopharmacology, contains thymoquinone, which also has anticoagulant effects. When you combine both oils, you're getting a double dose of blood-thinning compounds. If you're taking blood-thinning medications like warfarin, aspirin, clopidogrel, or any antiplatelet drug, adding these oils could cause excessive bleeding. Case reports in medical journals document serious bleeding complications, including gastrointestinal bleeding and excessive bruising. If you have scheduled surgery or dental procedures, stop both oils at least 2 weeks beforehand. The American Society of Anesthesiologists recommends discontinuing herbal supplements with anticoagulant effects before any surgical procedure. Warning signs of dangerous bleeding include unusual bruising, blood in urine or stool, nosebleeds that won't stop, gums that bleed, or exceptionally heavy menstrual periods. If you experience any of these, stop the oils immediately and seek medical attention. Danger number 2, liver stress and potential toxicity with long-term or high-dose use. Your liver processes everything you consume, including these concentrated oils. According to toxicology reports, oregano essential oil contains phenolic compounds that can cause liver stress at high doses or with extended use. Black seed oil is generally hepatoprotective at moderate doses, but studies in the Saudi Journal of Biological Sciences show excessive doses can have the opposite effect. When you combine both oils, especially at high doses, you're putting additional metabolic burden on your liver. This is particularly dangerous if you already have liver disease, take medications processed by the liver, or consume alcohol regularly. Warning signs of liver stress include fatigue, nausea, upper right abdominal pain, dark urine, yellowing of skin or eyes, and loss of appetite. Get liver function tests before starting and again after 30 to 60 days of use. Never exceed recommended doses and consider cycling your supplementation 3 weeks on, 1 week off to give your liver a rest. Danger number 3. Pregnancy and breastfeeding contraindications. This is absolutely critical if you're pregnant, trying to conceive, or breastfeeding. According to reproductive toxicology, oregano essential oil has emmenago properties. It can stimulate menstrual flow and cause uterine contractions. There are documented cases of oregano oil being used historically to induce menstruation or terminate pregnancies. Black seed oil also lacks sufficient safety data during pregnancy, according to the Journal of Obstetrics and Gynecology. The combination is particularly dangerous because of oregano oil's uterine effects combined with black seed oil's hormonal influences. If you're breastfeeding, both oils pass into breast milk. According to breastfeeding medicine, there's insufficient data on safety for nursing infants whose developing organs may not process these compounds effectively. If you're pregnant, trying to conceive, or breastfeeding, avoid both oils entirely. Wait until after you've finished breastfeeding before considering supplementation. Danger number 4. Autoimmune condition complications and immune system overstimulation. This is critical if you have rheumatoid arthritis, lupus, multiple sclerosis, or other autoimmune diseases. According to international immunopharmacology, black seed oil has significant immunomodulatory effects. Oregano oil also stimulates immune pathways, according to studies in medicinal chemistry. For people with overactive immune systems already attacking their own tissues, further stimulation could worsen symptoms. If you have an autoimmune condition and take immunosuppressive medications like methotrexate, azathioprine, or corticosteroids, these oils could interfere with your treatment. The American College of Rheumatology advises consulting your rheumatologist before starting any immune-modulating supplements. Now, before we continue, please click the like button if you're finding this safety information valuable. It helps others discover this critical information before they make potentially dangerous mistakes. And subscribe for honest, research-based health content that prioritizes your safety over selling supplements. All right, let's continue. Danger number 5. Severe allergic reactions and skin sensitivity. Both oils can cause serious allergic reactions in susceptible individuals. According to Contact Dermatitis Journal, oregano essential oil is a known contact allergen causing dermatitis, rashes, and severe skin irritation. Case reports in Annals of Allergy show some people develop severe reactions, including anaphylaxis, to black seed oil. If you're allergic to plants in the Lamiaceae family, mint, basil, sage, lavender, you're at higher risk for oregano allergy. Those allergic to Ranunculaceae family plants may react to black seed oil. Before taking either oil internally, do a patch test. Apply a tiny amount of diluted oil to your inner forearm and wait 24 hours. Signs of allergic reaction include hives, itching, facial swelling, difficulty breathing, rapid heartbeat, or severe stomach pain. Never apply undiluted oregano essential oil to skin. It can cause severe chemical burns and tissue damage. Danger number 6. Dangerous interactions with diabetes medications and risk of severe hypoglycemia. This is critical if you have diabetes or take blood sugar lowering medications. According to the Journal of Medicinal Food, black seed oil lowers blood sugar through multiple mechanisms, including improved insulin sensitivity. Oregano oil also affects blood sugar metabolism, according to studies in the journal Metabolism. If you're taking diabetes medications like metformin, sulfonylureas, or insulin, adding these oils could cause dangerously low blood sugar, a condition called hypoglycemia. The American Diabetes Association lists hypoglycemia symptoms as confusion, dizziness, shakiness, rapid heartbeat, extreme hunger, and loss of consciousness. If you have diabetes and want to try these oils, work closely with your doctor to monitor blood sugar carefully and adjust medications as needed. Start one oil at a very low dose while monitoring blood sugar. Wait several weeks before considering adding the second oil. Check your blood sugar more frequently when starting these supplements, before meals, 2 hours after meals, and before bed. Keep detailed records to share with your doctor. Danger number 7. Quality and purity issues leading to contamination and adulteration. This danger is often completely overlooked. According to Food Chemistry Journal, essential oils, including oregano, are frequently adulterated with cheaper synthetic compounds. A study in Flavor and Fragrance Journal found up to 75% of essential oils tested were either adulterated or mislabeled. Black seed oil faces similar problems. According to the Journal of Food Science, black seed oil is often mixed with cheaper vegetable oils. Some manufacturers add synthetic thymoquinone to make low-quality oil pass laboratory tests. Studies in environmental monitoring and assessment found essential oils from certain regions contaminated with pesticides, heavy metals, or bacterial endotoxins. The FDA doesn't test supplements before they reach consumers. Only purchase from reputable companies that provide third-party testing certificates of analysis. Look for products tested by independent laboratories like USP, NSF International, or Consumer Lab. Check for verification of active compounds, heavy metal testing, microbial contamination testing, and confirmation that the product contains what the label claims. Be suspicious of products significantly cheaper than market average. Now let's discuss who should absolutely never take this combination under any circumstances. Avoid these oils entirely if you are pregnant or breastfeeding, have a bleeding disorder like hemophilia, are scheduled for surgery within 2 weeks, have severe liver disease, or have a known allergy to either oil. Also avoid this combination if you take blood-thinning medications, have an autoimmune disease without doctor supervision, take immunosuppressive drugs, have uncontrolled diabetes, or are under 12 years of age. For everyone else who might be appropriate candidates, here's how to use these oils more safely if you choose to supplement with them. Start with one oil at a time, not both together. Begin with black seed oil for 2 to 3 weeks, monitor for any side effects, then consider adding oregano oil only if the first oil was well tolerated. Always take oregano essential oil in capsule form or heavily diluted, never undiluted. According to toxicology guidelines, undiluted oregano oil can damage mucous membranes of your mouth, throat, and digestive tract. Start with the lowest possible dose. For oregano oil, that's typically 100 to 150 milligrams once daily. For black seed oil, start with half a teaspoon daily. Take both oils with food to reduce stomach upset. Limit your duration of use. According to Phytomedicine Journal guidelines, essential oils like oregano should not be taken continuously for more than 3 to 4 weeks without a break. Consider cycling your supplementation. Take the oils for 3 weeks, then take at least 1 week off to give your body a rest and prevent compound buildup. Get baseline blood work before starting, including complete blood count, comprehensive metabolic panel to check liver and kidney function, and fasting blood glucose if you have diabetes. Repeat these tests after 30 to 60 days of supplementation to ensure the oils aren't causing problems with your liver, kidneys, or blood counts that you can't feel yet. Store your oils properly in dark glass bottles away from heat and light. Both oils degrade when exposed to air, light, and heat, losing potency and potentially forming harmful oxidation products. Watch for warning signs requiring immediate discontinuation. Any signs of bleeding, yellowing of skin or eyes, severe abdominal pain, allergic reaction symptoms, unusually low blood sugar, or any other concerning symptoms. Most importantly, never use these oils as a replacement for prescribed medications or medical treatment. They can complement proper medical care, but they are not substitutes for evidence-based treatments. Here's my bottom line recommendation. Oregano oil and black seed oil can both have health benefits when used appropriately and safely, but they're powerful substances that come with real risks. The 7 dangers we've discussed: blood-thinning effects, liver stress, pregnancy risks, autoimmune complications, allergic reactions, diabetes medication interactions, and quality concerns are all serious and potentially life-threatening in certain situations. If you're considering using these oils, especially in combination, please have an honest conversation with your healthcare provider first. Bring this video information with you to discuss. Don't rely on information from supplement companies or natural health websites that have financial interests in selling products. Get objective medical advice from someone who knows your complete health history. And if you're already taking these oils, make sure you're monitoring for side effects and getting appropriate laboratory testing to ensure they're not causing harm you can't feel yet. So here's my question for you. Have you experienced any side effects from oregano oil or black seed oil that you didn't expect? Or do you have concerns about using these oils that I didn't address? Please share your experiences and questions in the comments section below. Your experience could help someone else avoid a dangerous situation. Click the like button if this safety information was valuable to you, and subscribe for more honest, evidence-based health content that prioritizes your safety over selling supplements. Thank you for watching, and I'll see you in the next video.